Mr. Brent Ness. He's the CEO, president, and director of Aclarion. Of course, their ticker symbol ACON. Always great to have him on our fine program here. Brent, thanks for joining us once again. How are you, sir?
You bet, Mike. I'm doing great. How about yourself?
Can't complain. We're doing this job.
Hey, well, yeah, we get paid for doing this, which is amazing. Hey,
Goofing off.
Brent, great to see you again. Let's talk about what, just straight from the go-get, as Aclarion starts to get more popular, I get more and more email every time we do an interview with you. Talk about exactly what you guys do. Do a top-down approach of what your model is.
Yeah, you bet. Thanks, Sully. We are trying to help clinicians define where the pain is coming from in chronic low back pain patients. So we use what's called MR spectroscopy. In the MR, at the hospital down the street, there's this capability called spectroscopy. And rather than creating a picture of your spine, what spectroscopy does is it measures the content of the area of interest. So in our case, it is literally measuring what's inside the lumbar discs of the spine.
Jeez.
And as it turns out, as science has taught us, if you have a lot of acids inside the disc and a low quantity of structural integrity biomarkers, namely proteoglycan and collagen, then that disc, even though it looks good on that picture that you just showed, it can actually be the source of pain. And the problem is, downstream of that interpretation of just the picture is a painful disc will go untreated. This, of course, leads to revision surgeries, the poor outcomes, and obviously a lot of money is spent when we go into surgery and the outcomes aren't positive. $2.2 billion in the United States alone is spent on spine revision surgeries. So we're really, striking at the value here of both, not just to the patient who is no longer in pain because they had the right procedure, but the healthcare provider, the hospital, and of course the insurance companies.
Brent, when you talk about the acids causing the pain, is that a naturally occurring acid in the body, or is it me eating too many flaming hot Funyuns and I'm just doing it to myself?
Boy, Mike, that's a great question. Listen, the why those biomarkers are in there is, it's kind of beyond us. It's certainly beyond me and what we do here at Aclarion.
Okay.
We're just here to identify that, in fact, they are there.
Okay.
And that disc should be treated or not treated. If the structural integrity is really high and the acids are low, then the doctor can make that decision as well. And it's all about being accurate. I like to say, kind of joking around, your right elbow doesn't get better if they operate on your left elbow. It is that, it's more complicated anatomy than that in the spine, and trickier to diagnose for sure, but that's true.
I actually think that's in medical books now.
Well,
Right.
I remember going for knee surgery, and they did put an X on with a felt pen on one of my legs before I did, because it's an issue. You mentioned that chronic low back pain is the number one source of expenditures in healthcare. Is that been the case for years and years, or is this something that's a lifestyle issue of ours in the last, let's say, 10, 20, 30 years?
I don't know that they were measuring it quite as astutely 30 years ago as they are today. The dollars behind healthcare expenditures has become a very strong focal point. But I can tell you that over the course of the last 5 years, it has been the dominant cost driver in healthcare. Number one driver of costs is chronic low back pain.
Brent Ness is the CEO, president, and director of Aclarion. Their ticker symbol is ACON. Brent, how many people would you say probably have a more serious condition with their, air quotes, bad back than they really know?
266 million people.
It's a lot of people.
Mike, suffer from chronic low back pain. That's a global number. So it really is, it's an epidemic disease. And again, we're talking about the kind of back pain that keeps people from doing the things that they want to do, coaching their kids, sports, frankly, going to work,
yeah,
and having a productive life. So we're really focusing in on those patients that are headed to treatment of some kind, be it surgery or pain management injections or some other form of treatment for the problem.
Well, what is interesting is with the University of Google and now with ChatGPT, I think that's going to make it more dangerous, and it's going to sort of make what you guys do more important going through. How do you create adoption for this? Because I think that's got to be a speed bump for you guys, or at least something you have to look to resolve in the future. Correct?
Like you said, you opened up the program saying that you get paid to do this job. I feel the same way. We are in such an exciting time in healthcare. The use of AI, the transformation of brick and mortar kind of thinking to how do we leverage this, Dr. Google? How do we take advantage of the fact that complex healthcare information can be translated to actionable results for people that are suffering from any number of different ailments? So for us, it's still traditional in many ways, but believe me, we're going to be leveraging all of the tools available to us now, the go-to-market tools, the specific identification of people via search engines that are suffering from this ailment so that we can target our message exactly where it can make the most impact. So I feel good about where we're at. We now have centers throughout the United States, obviously London, we've talked about that in the past as one of our key markets, where if you or a loved one is suffering from chronic low back pain and you want your physician to benefit from having the specific biomarker information about your back, you can get that test done in New York, in New Jersey, in Denver, in Colorado Springs, in Texas, San Diego, LA, soon to be Chicago and Indianapolis. We got a brand new center we're rolling out in Grand Rapids, Michigan. So it's there, and certainly anyone in London.
Brent, I can't wait to get you in studio. I'm going to pull you out of Colorado and bring you in here because we can keep you for a couple hours. I can do 2 shows with you, man.
My back hurts right now.
We're going to have an operating table. We'll have a big table with a white sheet on in the middle of the studio. Brent Ness, CEO, President, and Director of Aclarion, their ticker symbol ACON. And speaking of C, Mary Burt-Godwin, we will see everybody later because that's the end of the Big Biz Show.
See ya.
See you next time.